The need for Nigerian government to increase budgetary allocation to the health sector has been re-emphasized. Key players in health and business sector of the economy say this will help revitalize various primary and other healthcare facilities across the country. We have details in this report.
Nigeria hosted the heads of state of member countries of the African Union in 2001, who made the Abuja Declaration, under which the leaders pledged to commit at least 15% of their annual budgets to improving their country's health sector. Since the declaration, Nigeria has not attained the pledged funding benchmark, as the federal government has never voted more than 6% of its annual budget to the health sector. Franco-Nigeria Chamber of Commerce and Industry is using this gathering to look critically into issues surrounding universal healthcare coverage.
50% of the national budget should be allocated to supporting healthcare. That has not been done at all. 2009 and 19 is 3.9%, which is a far cry from what we expect. What we expect now is that the government should focus more on ensuring that they finance healthcare. Infrastructure for healthcare costs a lot of money. They finance healthcare, and then most especially private-public partnership should come on board healthcare to ensure that we take this thing to the next level.
Making links between business communities in France and Nigeria, and this event that they are hosting this morning related to health is very, very important. So as I'm still new here and still on a discovery mode, I'm sure we can do many things to contribute to the health system in Nigeria.
For Lagos State government, meeting the budget benchmark and initiating policies that will help revive various public health centers across the state remains paramount to the present administration.
Lagos State is doing a bit better than federal. We're currently at about 8%. And we have the commitment from this, His Excellency Governor Babajide Sanwo-Olu, that by the end of this 4-year tenure, he's going to edge up government spending in health closer to 15%. And if we're able to do that, then that will have a huge impact on the 3 tiers of health, which are primary, secondary, and tertiary.
60% of healthcare is being delivered by the private sector. So you can imagine if you can bring in that synergy and that expertise that they have into the public space and to work together to do that. Also, like we've also heard here, there's also a need to work on the pooling system as well as a risk-sharing initiative for people that want to come and invest in healthcare, so that there's more of a drive and an attraction to come into the space to make it better.
Franco-Nigeria Chamber of Commerce and Industry says its aim is to develop, foster economic and commercial investment relations between France and Nigeria.